Hello everyone, this is Horit and you are watching Medical Masterminds. In this video, we will be continuing our previous lecture that is related to coagulation cascade. Those who haven't seen that video, please go and watch it. And the link is in the description. Please go and click on the link to watch the video. Okay. So before talking about heparin, we have to know one point, and that is liver makes a protein, right? A special type of protein known as antithrombin 3, right? It actually inhibits the activation of factor number 2, that is the thrombin, and the activation of factor number 10, right? Why this is very important? Because it actually blocks the coagulation cascade or the pathways, because as in the previous lecture we have seen that see in this particular part, if this step and this steps gets blocked, right? If these two steps do not occur, then at the end the fibrin mesh will also not able to occur, and there will be no stabilization of the clot, and the clot is easily breakable, right? So if the antithrombin 3 blocks these two, you can say this the activation of prothrombin and the activation of factor number 10, then at the end the clot will not able to withstand in the particular area, and at last the clot will break. So that's why antithrombin 3 is a very important protein to block the coagulation cascade, right? Okay. Or you can say antithrombin 3 is a special protein that actually prevent the formation of a clot. So this is very important, right? So now let's talk about the heparin, right? Okay. Before talking about the types of heparin, let's just talk about the normal simple overview of the mechanism of action. As heparin is administered in anyone's body, suppose this is a body, right, and heparin is administered inside it. So after administering heparin, what happens is that the heparin actually binds with the antithrombin 3. It actually binds with the antithrombin 3, right, to show its action. See, remember one thing, heparin alone is useless, right? If it not able to bind with antithrombin 3, then it will not able to show its function. So in direct point of view, we can say that heparin actually accelerates the function of antithrombin 3, right? The heparin actually accelerate the function of antithrombin 3. It do not have any special function, right? It only accelerate the function of antithrombin 3 by different mechanism, right? Okay. So this is the normal overview of the mechanism of action, right? Okay. As we have talked, what is the function of antithrombin 3? Antithrombin 3 actually blocks the activation or inhibits the activation of factor number 2, that is prothrombin, and the activation of factor number 10. So after administering heparin, it actually do the same thing, or the antithrombin 3 actually do the same thing, but in a accelerated manner because of the heparin. So this is the main point. Okay, now we have to know. See, now we have to know the types of heparin. There are two different types of heparin. One is unfractionated heparin, or you can say high molecular weight heparin, and another is low molecular weight heparin, right? Okay. Now there in the name we have just discussed, that is high molecular weight, low molecular weight. What is the meaning of high molecular weight or low molecular weight? Yeah, from the name it is very much easy to understand that high molecular weight means it has a quite high molecular weight, and in low molecular weight heparin, the heparin has a quite low molecular weight, right? But we have to know why it is so, right? So let's understand. In a normal heparin molecule, it is in a normal heparin molecule, there is there are two parts, right? One is the pentasaccharides, and another is the glycosamine glycan, right? Glycosamine glycan or GAG, right? There are two parts in a normal heparin structure, right? These two parts actually present in both the high molecular weight heparin as well as the low molecular weight heparin. These two parts are present in both, but in high molecular weight heparin, the GAG part is quite long, right? And in low molecular weight heparin, the GAG part is quite short. That's why there is a difference between the molecular weight. That's why, because of the difference in the GAG chain, you can say. Okay, that's the main part, right? Okay, this is very much simple. Now there is another you can say heparin, that is synthetic heparin, right? And the name is just remember this, it is not that much important. The name is fondaparinux. It is a synthetic heparin. Just remember it. We will not discuss in details because it's not that much important. Okay. Now there is a very interesting part you have to know. As I have talked about in the previous part, is that heparin binds with antithrombin 3 to show its function. Now if in any patient there is a deficiency of antithrombin 3, then the heparin will not able to function, right? This is a very interesting part. Suppose let's talk about as antithrombin 3 is made or the liver actually synthesizes this protein. So basically the liver actually synthesizes this protein. If the liver gets damaged in any case, then there is a chance that the liver will not able to make this protein. So if the body do not have antithrombin 3 or the body is deficient of antithrombin 3, then if that person is administered the heparin will not able to function. So it is useless to administer heparin in this kind of patients, right? So let's talk about let's take one example in liver failure, right? This may occur, and as well as there is a very important example is that in nephrotic syndrome also, if a patient or is a person having nephrotic syndrome, then the heparin will not work, because what happens is nephrotic syndrome, the kidney loses or excrete out a lot of protein. The kidney, right, the kidney loses out a lot of protein, and this protein excretion is very much. So what kind of protein? And this protein is nothing other than antithrombin 3. So in these two cases, in liver failure and in nephrotic syndrome, right, the heparin will not actually function properly, right? So administering heparin in this kind of patients is quite useless, and the heparin not able to function, right? Okay, let's discuss, or let's get back to this particular topic. As we have learned that there are two types of heparin, that is unfractionated or high molecular weight heparin and low molecular weight heparin. So let's talk about the mechanism of action of these two. It's very simple. Just remember one thing, in unfractionated heparin, it actually inhibits both factor 10 as well as factor 2. It actually inhibits both factor 2 as well as factor 10, right? But in low molecular weight heparin, it only inhibit factor number 10. It only inhibit factor number 10, right? Because why it is happening so? Because in unfractionated heparin, as the GAG chain or the GAG tail is quite large, so it has the capacity to inhibit both the factors, but as the low molecular heparin, it has the shorter GAG chain, so it only you can say inhibit factor number 10, right? So this is the main difference between these two. Okay, so now let's talk about the indications of administering heparin. Normally there are 3 indications in which we can administer heparin. Number 1 is acute deep vein thrombosis, acute DVT, right? Number 2 is pulmonary embolism, and number 3 is STEMI or NSTEMI, that is ST elevated myocardial infarction and non-ST elevated myocardial infarction. Okay, so these are 3 main indications in which we can administer the heparin. Okay, now some important points, or you can say some very interesting point that you should know about heparin. Now there is a question that you can ask, is that when to use unfractionated heparin and when to use low molecular heparin. See, this is very much dependent on the situation, right? Normally unfractionated heparin is good for emergencies, right? Unfractionated heparin is good for emergencies. So it is totally dependent on the situation and the severity of the you can say the severity of the deep vein thrombosis or any other cases as we have discussed, right? Another point you have to remember is that low molecular weight heparin is administered subcutaneously. Okay, and unfractionated heparin generally given in bolus form, right, and in infusion pumps. So these are the interesting, or you can say very much unique points that you should know. Okay, one thing you have to know, in prophylaxis of DVT or pulmonary embolism, low dose or low molecular heparin is generally used. So in prophylactic purposes of DVT and or you can say pulmonary embolism, specifically low molecular weight heparin is given. Okay, so there are various kind of adverse effects of administering heparin. So let's discuss some of them. So number 1 is there may be nostril bleeding. There may be nostril bleeding. There may be hematuria. Hematuria means blood in urine, right? Blood in urine. There may be melena, that is blood in stool, right? Okay, so there may be heavy menstrual period bleeding, heavy menstrual bleeding, right? There may be hematemesis. There may be hematemesis, that is blood in vomit. So these are some of the adverse effects that you can see in patients who are getting heparin in a very high amount. So these are the adverse effects that we discussed. So, okay, so one thing you should remember is that about the antidote of heparin. Suppose you are seeing someone having the side effects of heparin, and then you have to deal with it. So how you can deal with it? By administering the antidote of heparin. So what is the antidote of heparin? It is known as protamine sulfate. So the antidote of heparin is known as protamine sulfate. And one point also you should add in this is that this protamine sulfate is very much effective in unfractionated heparin, but quite low effective against low molecular heparin. So it is quite more effective in unfractionated heparin, and it is less effective in low molecular weight heparin. So these 2 points you should remember, right? These are very important. Okay, so this is all about today's lecture. In the next lecture we will be talking about heparin induced thrombocytopenia. This is very important. So thank you for watching up to this. Please subscribe my channel. I always try to explain completed topics in an easy manner, so keep on watching.